Good afternoon, everyone. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador College of Social Workers. I will be your moderator for today's education event, Psychological Health and Safety, Creating Mentally Healthy Workplaces. The webinar presentation will be approximately 60 minutes, followed by a 30-minute question and answer period that I'll moderate. During the presentation, I encourage you to type in your questions using the Q&A widget at any time, and I'll begin asking the questions at the end of the presentation. The recording of the webinar will be available on the NLCSW website under the Continuing Education tab in the coming days. I now want to introduce our speaker for this afternoon, John Dinh. While John's full bio can be accessed through the bio widget, I do want to say a few introductory words. John is a registered social worker and has been working with the Canadian Mental Health Association Newfoundland and Labrador Division since 2016 in the role of Workplace Mental Health Coordinator. John has had an extensive career in the field of mental health and addictions. In addition to his academic education in social work and psychology, John is a Canadian Mental Health Certified Psychological Health and Safety Trainer and a Mental Health Commission of Canada Certified Mental Health First Aid Trainer for adults, youth, and seniors. John is also a certified master trainer and bronze pin holder for ASSIST, which is the Applied Suicide Intervention Skills Training, and a SafeTalk trainer for Living Works. He is also a certified trainer for CMHA's Co-Workers First course, a CMHA's Resilient Minds trainer for firefighters, and a trainer for CMHA's National Award-winning program, Mental Health Works. I was very excited when John reached out to our office to facilitate this webinar for his social work colleagues. John is very passionate about mental health and sharing knowledge and learning to others to promote mental health. And on that note, I will now pass the virtual podium over to John to begin today's presentation.
Thank you very much, Annette. Appreciate that. And I also appreciate you folks for joining us today, taking some time out of your busy day, on a Monday at that. So I really appreciate people taking time out to sit in on this. So we're going to be talking about psychological health and safety in the workplace. So we're going to be talking a little bit about the standards, the new psychological health and safety standards. And actually, they're not all that new anymore now. They've been out since 2016. And so a lot of places have actually started using them now. And they should be hopefully very familiar to most people now. We're going to talk about the psychosocial factors that are involved with those. Some of the benefits of implementing psychological health and safety standards in your workplace, the role that we can play, your employers can play, and at the end we'll also have some time for some questions in that as well. So, like Annette mentioned, make sure you put your questions as they come up in the question box, and we'll look at those afterwards. So, just this disclaimer about the presentation. So this is not an actual professional advice or anything like that. It's more about providing information. And so we don't offer this as any type of diagnostic or treatment service or anything like that. And the presentation handouts that are property of CMHA. So if you wanted to have copies later, by all means reach out to me or CMHA. We can probably get you copies of that. So our land acknowledgement agreement, we respectfully acknowledge that the land in which we gather as the ancestral homelands of the Beothuk, whose culture has been lost forever and can never be recovered. We also acknowledge the island of Ummakukuk, Newfoundland, as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we also acknowledge Labrador and the ancestral homelands of Innu and in Nunatjian, the Inuit, and in Nunavut, and the Innu of Nunatsiavut. We recognize all peoples, all first peoples who were here before us, those who live with us now, and the 7 generations to come. As first peoples have done since the immortal, we strive to be responsible stewards of the land and respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in the spirit of truth and reconciliation. So a little also about CMHA. So this is one of the presentations that we do for workplaces. Is actually a course that we do. We do a champions course, and we also do a psychological health and safety advisor training, which is an intense 4-day training, 4 half-day webinar training. So what I've done is I've kind of reduced it down to kind of an introduction for all of us today, and some things that we can do at our own level to help with our own psychological health and safety. So CMHA is one of the oldest charities in Canada. We've been here since 2000. I think it was 1918 was when we first started. So they were a nationwide leader and champion for mental health. And we're also part of a national network. There's over 120 branches across Canada. And we help access resources for people with mental health or community integration, help build resilience, and support recovery from mental illness. And there's 3 offices we have here in Newfoundland. We have one in St. John's, and we have another one in Grand Falls, Windsor, and another one on the West Coast in Stephenville. So some of the things, and some of you may have heard or seen some of these stats of why we must act or do things to protect our own mental health, not only in our personal lives, but also in our workplaces. So in 1 in 5 of us at any point in time can experience a mental illness. In our lifetime, that number is about 1 in 3. And the cost to our economy is over $50 billion. The other thing, too, to keep in mind is that 5 in 5 of us have mental health. And so we need to make sure we do things on a regular basis to look after our mental health. And mental illness is the second leading cause of disability and premature death in Canada. So if you look at the number of ways someone can, die, mental illness is the second leading cause. So that's something that we really need to pay attention to. And some of the stats on like short-term and long-term disability claims show that about 30% of claims are related to mental health problems and illnesses. And also 4,000 Canadians die each year by suicide. So that's an average of 11 suicides a day. So that's a great concern, a mental health concern that we all need to kind of look at and pay attention to. So when we talk about health and safety in the workplace and working conditions, it has progressed over the years. So criminal law prohibits physical violence or threats of violence in the workplace. So that was physical safety, and that was basically in the 1970s. Then in the 1980s, human rights legislation prohibited workplace discrimination based on age, gender, ethnicity, religion, disability, sexual orientation, etc. So that was basically in the 1980s. Then we had employment standards, so occupational health and safety, workers' compensation legislation, expanded policies to take in bullying, harassment, and compensation for mental disorders in 2010. And so we also have now in government agencies now where we have a workplace harassment and respectful workplace legislation. And then the national standard of Canada for psychological health and safety was actually started in 2013. So that's when they actually first started it. So now we're looking at what things do we do now for our psychological health and safety, not just our physical or occupational health and safety in workplaces. So workplace stress. So we often hear about that. We often experience it. But what is it? So workplace stress is the harmful physical and emotional response that can happen when there's a conflict between our job demands on the employee and the amount of control an employee has over meeting these demands. So I think a lot of us can relate to that, having these demands on us all the time, but we don't have any control over that, right? In a lot of places, a lot of workplaces, people are experiencing a lot of impact through effects of stress or unmanaged stress, and can lead to a lot of unproductive patterns and loss of focus and productivity at work. So employees who experience high demand, low control, high effort, and low reward are more likely to suffer adverse consequences of a psychologically unsafe workplace. So when you think of that, when you have a workplace that you have constant high demand, but you have low control over your workflow or workload, and then you're constantly required to have high effort, but there's low reward, all of these factors can certainly influence our psychological health and safety in the workplace. So there's a lot of organizational stressors there that can impact us. Some other factors is fear of redundancy in jobs, layoffs due to uncertain economy. So when you think about recently, going through COVID, there was a lot of uncertainty for people with workload, having to do work differently, having to, adjust to different work precautions now, having to maybe work hybrid work situations, working from home, having to learn how to use new technology and that. So all these pay increased demands. Could be overtime. People have this feeling to perform. Can take a toll on our job satisfaction, and sometimes can lead to employees turnover or reduced efficiency or increased illnesses and absenteeism, indifference, apathy, lack of motivation and creativity. So all these things can lead to our stress, our cumulative stress, all the different things we may face during COVID and in our workplaces. So some of the things we can do, what the psychological health and safety standards do, is they address kind of like a business case for why should workplaces implement these standards, right? So some of the things that they find is that it increases improvement in recruitment and retention of employees. So employers who create and sustain a great place to work will attract best workers, and also workers will want to stay there. It also will improve employee engagement. So engaged employee is someone who's fully involved and enthusiastic about the work. When the employees are engaged, they view their interests as aligned to those of the company, and they're more willing to extend like their extra effort or to assist, in their workplace. So basically, there's improved performance and productivity and in the workplace. In terms of improved sustainability, workplaces that are more resilient respond to demands and challenges that may be placed on them. So if your workplace is psychologically healthy, your workers are probably also better equipped to thrive when facing challenges. So if you're facing the challenges, some of the changes that we have to go through for COVID, if you had a good psychologically healthy and safe workplace, we probably were able to adapt, better to those situations, those changes. And another case for it is improved health and safety. So employers who thrive to create an atmosphere where there is a shared commitment to employee well-being and security, again, that creates a good atmosphere for psychological health and safety, and and also for looking out for your other co-workers in that workplace, accommodating people or working together as a team. So those are some of the business cases for why workplaces should consider or promote psychological health and safety standards. So there are also some legal cases why workplaces should also be looking at this. So providing a psychologically safe workplace is recognized as a legal duty and is similar to the duty to provide a physical safe workplace. So an employer must take every reasonable precaution to protect employees' safety and to show that they have done so. So ensuring a psychological safety calls for a new standard of conduct at work, and the standard requires that people treat one another with fairness, civility, and respect, regardless of your power or status within the organization. So we want to make sure that you're doing things, basically some things like preventing bullying, harassment, discrimination, or imposition of unreasonable work demands, or refusing employees, like minimal leave or control over the workload or work pace. So these are some of the things now that we're looking at in terms of the legal case for psychological health and safety in the workplace. So there's 7 branches of law. Employers, have a duty of care for workers' psychological health and safety. So there's harassment and bullying, workplace violence prevention. There's employee contract law. There's labor law. There's tort law. There's employment standards legislation, compensation legislation, and also advancing a strong, safe culture. So this is from the Workplace NL. And basically what they have done now, they're looking at psychological health and safety as an injury and illness priority in Newfoundland and Labrador. So Workplace NL and its partners develop and deliver training programs to better protect workers from psychological health and safety risks in workplaces. And CMHA also offers training in psychological health and safety, workplace mental health. So some of their goals is about providing psychological health and safety, prevention strategies, education of employers, employees, and provide learning resources as well to aid in, preventing cumulative effects of stress and trauma on people in the workplaces. And these are also some of the things that CMHA offers in a lot of their trainings and that to workplaces as well. So the health case for psychologically healthy and safe workplace. So there's strong evidence that certain features of the workplace can affect mental health and physical health of employees. So there's lots of things that can actually impact employees in the workplace. And workplace risk factors that increase the likelihood an individual experience increased stress can in turn increase the likelihood of developing or worsening mental illness. So we want to look at workplaces that are there things there in the workplace that increases people's stress in the workplace. Workplace factors may increase the likelihood of the occurrence of a mental disorder, make an existing disorder worse, or impede effective treatments and rehabilitation. Someone had there, can you explain tort law? So tort law is basically when through negligent means we cause harm to a person, either emotionally or physically. And again, unlike criminal law, it can be processed in the court, and a person can be held accountable for damages that negligence has caused to someone's health, whether it be physical health or mental health. So that's kind of what tort law means. Health case continue again. Mental health problems are the fastest rising cause of short-term and long-term disabilities, with costs borne by private and public sectors, employers, and taxpayers. Mental health problems are expected to be the source of more than 50% of all claims administered over the next 5 years, exceeding even heart disease. These stats are old here now, but in actual fact, mental health disorders are the number one cause of disability claims. Actually, depression is the number one now, according to the World Health Organization. It is actually higher than heart disease. So again, it's more the reason why we need to actually pay attention to our mental health in the workplace. And a supportive work environment can reduce the onset, severity, impact, and duration of a mental health disorder. So, if you have a supportive work environment, it certainly would do a lot of good to actually eliminate some of the factors or reduce them, the effect on our mental health. And organizations that make the effort to identify psychosocial risks and create a psychologically healthy workplace reap benefits. So you'll see a lot more productivity in people, sustainability, and growth in your organization if you take a look at your psychological health and safety of your workplace. So based on what we know so far, what you know from your own personal or work experience, what is it your organization doing to address mental health in your workplace? So, what are some things you can identify in your own workplace that you see that's being done to help promote mental health in the workplace? Just wondering if anyone wanted to put your answers in the chat, just to get an idea of what people are doing now or seeing in their own workplaces. What might be some things that you note in your own workplace that you see is happening to promote or address mental health? Employee assistance programs, yes, absolutely. Simone, maybe promoting employee assistance programs in your workplace. How do you access it? Letting people know that it's free, it's offered by a third party. If you've worked, used it, right? Like, lunchtime activities, so going out for a walk, getting walking groups, getting outside. Health insurance benefits. So, what are some of the health insurance benefits? Are people being, notified what the health insurance benefits you can get? Employee recognition, yeah, absolutely, that's a great one, Stephanie. So, employee recognition benefits, or just recognizing someone. That doesn't have to be like an award. That could be just letting someone know, in team meeting, I really appreciate what you did with that client, or how you handle that situation, or just regular things we can do, right? So on a regular basis, sometimes we might give, I don't know, rewards out to people on a monthly basis or something like that, right? So anything at all that recognizes how someone has contributed to the work well-being in the workplace, yeah, absolutely, it goes a long way in creating a psychologically healthy workplace. Mental wellness first aid kit, yeah. So yeah, having a mental wellness first aid kit or promoting mental wellness at work, that right? Promoting things you can do for your own mental health and well-being at work, right? Absolutely. Thank you, folks, for that. So we'll move along then to the standards. So what is the standard? Some people may be aware of this or not, but the commission, so the Mental Health Commission of Canada, and also Bureau of Normalization de Quebec, and also the Canadian Standards Association, in 2013 got together and created these set of tools, guidelines, they're not rules as such, to prevent psychological harm from conditions in the workplace, and also to promote psychological health in the workplace as well. This is what they came up with standards. So we also had some other things from our last slide. Weekly department debriefing meetings, yeah, absolutely, strategies to reduce sedentary behavior for the organization. So things people can do to get out and get up and move, and that they say that sitting now is the new smoking, actually, at our desk. So good idea to get up and move in situations. So the standards, get back to standards. So these prevent psychological harm and they promote psychological health in the workplace. So there was a video I was going to show here, but we can't do it through this platform. So if you want to look for yourself later, there's a couple of really good videos by the Mental Health Commission of Canada that introduce the standards and are aimed at employers and decision makers. So if you want to check it out there, you can go to the Mental Health Commission of Canada, and they have a couple of videos there on the standards, some introductions to what the standards are and what they cover in that. So the standard itself, again, like I mentioned, these are a set of guidelines, tools, resources that are focused on promoting employees' psychological health and preventing psychological harm due to workplace factors. So they're voluntary. They're not a set of tools or rules as such. They're aligned with existing standards and tools. So they're very much aligned with, say, occupational health and safety as well. And they're intended to enable employees to measure progress. So it's a plan, do, check, and act kind of thing, process to it. And they don't create new legal obligations, but may influence some of the branches of the seven branches law that we already noted there. And someone else out here in the chat, they mentioned about celebrating occasions, wellness programs. So these again are some other things that we can do in our workplace to promote our own psychological health and safety. So the standard is basically made up of 5 pillars, and some of these things you already identified in the chat there. So some programs that can be done to promote workplace awareness campaigns, occupational health and safety, wellness programs, peer support programs, or self-help tools that we can offer in our workplace. Some policies could be accommodation policy, return to work plans, employee recognition. So I think we already mentioned that, have some kind of employee recognition, space for privacy, some benefits. So the EFAP programs, someone mentioned that as well. Short-term and long-term leave, paid leave for medical appointments, for family obligations, prescription drug coverage. So again, having some medical benefits, coverage for psychological services. So having coverage for counseling sessions and that, right? Or even increasing the level of coverage, or offering it for other things, even for family members and that. Training. So what are some training your workplace can do to increase your psychological health and safety? So resilience training, mental health training. So mental health first aid is a course that we teach a lot of workplaces in that. Anti-stigma training, we do a lot of that as well. You often hear about the Better Let's Talk campaign and that. So we do a lot of training to workplace on reducing stigma, normalizing, mental health and wellness in the workplace. Management training. What are some things that managers and supervisors and team leads can do to help their employees, who they might notice having some mental health concerns? Assessments, again, you can do guiding minds at work, some interactive tools, some mental health at work. So there's also some assessment tools that, as a manager or supervisor, you can access as well. So the national standard also, with doing this, there's an implementing standard as well, guidelines called Assembling the Pieces. And so that's a piece of research in that you can use. It's a good tool to be used with if you're looking at implementing the standards in your workplace that can be used as well. So with that, what are some of the challenges your organization is facing to address mental health in the workplace? So what are some challenges you can think of in your workplace now that you note that could be, in terms of addressing mental health in the workplace? What are some of the things you think that you need to address in order to better able to access or address mental health in the workplace, or access mental health concerns? Any challenges?
This is just Annette here. The group chat features on the left-hand side of your screen. It looks like 2 speech bubbles. So that's where you can enter your comments to the group chat.
Thank you for that, Annette. So if anyone, what are some challenges you're comfortable sharing? Or just some challenges you see in general if you don't want to identify your own workplace? Someone said human resources issues. Yeah, so maybe vacant positions. Yep, there's always that challenge when replacing staff or not having enough staff. Yep. Thank you, Stephanie. Staff turnover is always another one. Increasing demands, yeah, always on workload. If there's any issues with upper management, adjusting to changing workloads due to pandemic. Yep, that was always a big one. Recently, with changing, adjusting to COVID, and all that. Documentation standards, high caseloads. Yep. So our workload and that, there's always those things. Yep. Documentation. Yeah. So there's all kinds of things that sometimes that are going to impact there. Sometimes I feel like they're still in the reticence to discuss mental health challenges, and it is looked as less than important. Yes, absolutely. Mental health. There is no health without mental health. So our mental health issues are just as important, if not more important, in some cases. Staffing issues, having to mandate, provide critical. Yep. So there's all kinds of workplace things that are happening in our workplaces that provide challenges and barriers and that. And just getting back to the standard, the link probably does. If the link doesn't work that we have there, you can access the standards, those the videos and that. If you go onto the Mental Health Commission of Canada website, you can get more information on that. Low employee engagement to many things. Again, low staffing, more demands on staff. Yeah, engagement is always a big one. So thank you for that, folks, for sharing those things. So some of the things that the standard looks at is the psychosocial factors, again, that impact our work conditions, and that some of the things you've just identified. So the psychosocial factors are elements that impact employees' psychosocial response to work and the work conditions, and these can cause psychological health problems. So psychosocial factors include the way work is carried out. So again, some of the things you've already mentioned, deadlines, workload, work methods, and the context in which work occurs. So it could be a relationship or interaction with managers and supervisors, colleagues, coworkers, clients and customers. So these things, can potentially cause psychological health problems for people, right? So there are 13 psychosocial factors that interact and impact our organizational health and the health of individuals and the financial bottom line of the organization and the way work is carried out. And a lot of these factors are interrelated. So if a change in one occurs within the organization, it can either positively or negatively impact another factor. And this is likely to influence one or more of the other factors in a similar manner. So if your organization, for example, doesn't have very good civility and respect, that is definitely going to influence, your organizational culture and your psychological support in your organization. So this is why you have to look at all these together, and as a change in one can impact a change in the other, right? Um, so again, I'm going to move along. So these are the actual factors. And if you look at the standard, if you go on the Guardian Minds website or the Mental Health Commission of Canada, you can find all these factors and a better explanation of what they are. You can actually access videos that actually explain them in very clear ways. So, based on what you know about these, um, from your experience, which of these areas do you think that your workplace excels in? So, pick your top three. Everyone see the poll? Are the poll results up there for everyone to see? Oh, poll disappeared. Okay, let me just try this. Go back. Okay, let's try this again. Um, Someone said civility and respect, organizational culture, workload management. Not really seeing poll results come up here. Maybe I'll just have you look in the chat there. So some people said civility and respect, organizational culture, workload management. Okay.
So our tech is telling us that because there's a lot of options there, you need to users need to go to full screen to hit submit. So you need to be able to go down and hit submit for the poll after you click your options.
Okay. Thank you for that, Annette.
Yep.
It's the drama of using Zoom. So we'll see if our results come on this time. So you make it full screen and you can click on the bottom right to submit it. I need to pick your 3. Let me just see what the results come up now. No. Okay, well, we'll just go with the chat. Apologize for the technical difficulties. Yeah, so we just want to write 1 or 2 in the chat from your experience. So someone has already talked about civility and respect and organization culture, workload management. Those are pretty popular ones that most people identify when we do our workshops and that. Um, Engagement, yeah, engagement is another one people talk about what the workplace is doing well. So maybe we'll move along then. If there's any other ones people want to put in the chat. So I have another poll. Let's see if this one works. So this one is from your experience, which areas is the greatest room for improvement in your workplace? So in your experience, which is the greatest room for improvement that you see in some of these psychosocial factors? So just maybe if we get you to just pick one. So someone has here work-life balance, engagement. Okay, here we go. So the greatest room improvement, what we have in workplace, we have psychological support, clear leadership and expectations. So I'm going to make a note of these. We're going to carry on then. So social risk factors. So psychological support was one of the ones you identified. So again, when this is you have psychological support in your workplace, some of the things you're going to see is increased, when it's not there, sorry, increased absenteeism, withdrawal of behaviors. You're going to see conflict. You're going to see strain, headaches, burnout, anxiety in the workplace, turnover, loss of productivity, increased costs, greater risks of accidents, incidents, and injuries. So these are some things you're going to see in the workplace if you're not looking after psychological support in the workplace. Some of the other things you might see. So um, you know psychological support. What does it look like? So if you have psychological support, you're going to see more improved psychological health of employees. There's going to be successful, sustainable return to work if someone is off. Reasonable workplace support, sorry, during times of emotional distress and that. So you're going to see more support when people are actually, need support. An understanding and awareness of mental health. So you're going to be more understanding of mental health in the workplace. Um, some of the things. So this was a video that we were, but again, you can see these at the if you go to the Mental Health Commission of Canada, you can access these videos at each psychosocial factor. So some psychological support ideas that you could use in your workplace is try to eliminate mental illness and stigma. So having presentations or webinars or participating in Wellness Talk Day or CMHA's Mental Health Week. Again, all these go a long way promoting, eliminating the stigma of mental illness in your workplace. Also, would improve your awareness of mental health. That we need to be doing things to look after our mental health in our workplaces and that, and also training. Union management and how to respond to mental health. Is a factor. So, what are some training that your staff or your supervisors, managers, or that can be taken? So, mental health first aid courses. CMHA offers a number of courses, psychological health and safety in the workplace, co-workers first, some training that you can take to address mental health concerns in the workplace. So another one that we identified was clear leadership and support, and also civility and respect. So we're going to skip some of these. So these are some other factors. So again, a lot of these are accessible on the Mental Health Commission of Canada. But in the interest of time, I'm going to focus on the ones that we identified as areas that we can look at. So clear leadership and respect was another one we identified. So clear leadership and expectations is a support as a workplace, where there is effective leadership and support that helps the employee know what they need to do, how their work contributes to the organization, and whether there is impending changes. So sometimes it's not so much that there is no changes coming, but just letting people know that there are going to be changes. So helping people be prepared. Fear of the unknown is one of the major risk factors for people developing stress and anxiety, right? So letting people know that there are going to be changes coming, and we will have you as part of the change or be part of the process. So why is it important? Effective leadership increases employees' morale, resilience, and trust, and decreases employee frustration and conflict. So good leadership results in employees with higher job well-being, reduced sick leave, and reduced early retirement with disability pensions. So people will want to stay in the workplace, right? A leadership who demonstrates a commitment to maintaining his or her own physical and psychological health can influence the health of employees. So in terms of sickness, presenteeism, absenteeism, as well as health of the organization as a whole. So again, if you want to make sure that if you're a leader, you walk walk the walk and talk the talk. Presenteeism actually is when someone's in a workplace, but they're not actually, mentally there really, like they're not really engaged or not able to engage because of other things that they have going on. So, what happens when clear leadership and expectations are lacking? Again, again, what you'll see leaders who do not demonstrate visible concerns for their own physical and psychological health set negative examples for their staff, and that can undermine the legitimacy of the organization's programs, the policies, the services intended to support employees. So middle managers are at the greater risk because they must be the leaders and to be led simultaneously. So they have to be led, but they also have to be leaders. So this role conflict can, lead to feelings of powerlessness and stress. So you have to be able to be there for your staff to see the big picture and to hear complaints and be able to respond to people, let them know that they're important when you're looking at clear leadership. So some of the things clear leadership would look like in a workplace. Employees have clear expectations regarding their jobs and responsibilities and roles, so they know what they have to do, what they're responsible for, and how to do it. And employee morale is positive. Resilience is high even during times of stress and change. So, if morale is positive and there's resiliency in the workplace, you can most likely deal with the changes that come about. Employees have trust in their management, and there is less employee frustration or conflict. So when you have clear leadership and expectations, everyone should know what they have to do with their roles in the organization and have the supports to do them. Some of the other things, so clearly ideas to encourage it, encourage emotional intelligence and development of leaders, measure leadership competency, strive for direct, accurate, timely, face-to-face communications between managers and employees. So have those face-to-face contacts with your employees. Check in with your employees, not necessarily check up on them, but check in with them. How are they doing? What's going on in their personal lives? Things you might want to know about that may affect their work. So have those clear, conversations with people on a regular basis. It doesn't always have to be about work. And another one that we talked about was, I think, was civility and respect. So that was another one that we identified as a bottom three. So civility and respect is one of the major ones that workplaces look at because it impacts a lot of the other factors. So civility and respect is a workplace where employees are respectful and considerate in their interaction with one another, as well as with customers, clients, and the public. Civility and respect are based on showing esteem, care, consideration for others, and acknowledging their dignity. So, a civility and respectful workplace leads to greater job satisfaction, greater perception of fairness, more positive attitudes amongst workers, improved morale, better teamwork, greater interest in personal development, engagement in problem resolution, enhanced supervision, staff relationships, reduction in sick leave and turnover. So if you have a civil and respectful workplace, you're going to see people will want to stay there and want to, remain there and do well there. So organizations characterized by civility and respect create a positive atmosphere marked by high spirits and work satisfaction. It allows people to enjoy the environment, whether they are staff, clients, or customers. So when it's not there, when it's lacking, the workplace can lead to emotional exhaustion among staff, greater conflict and job withdrawal. So the workplace may become toxic, and mental health can suffer from, breathing in the social exhaust of an organization that is a toxic workplace. So a work environment that is uncivil and disrespectful also exposes organizations to the threats of more grievances, legal risks. So you might see some human rights, discrimination things, grievances coming in. One example, disrespectful behavior is bullying. So again, you might see more bullying in that and type of work environment. Some other things for civilian, what does it, look like in a workplace? So when you have a respectful workplace, there's effective teamwork and positive morale, reduce conflict among colleagues, effective resolution of conflicts when they do arise, and there's respectful leadership at all levels. So in a workplace that has civilian respect, you're going to see all these things in the workplace. That there's less conflict among staff. So some ideas you can do for your workplace: address uncivil behavior as soon as it happens. Don't let it fester. Don't let it snowball into bigger issues. Promote a respectful leadership behavior and adopt a non-discriminatory language. So that's one of the things that CMHA promotes is non-stigmatizing language when we talk about mental health concerns and that. So these are some ideas that you can use for civility and respect in your workplace. So those are some of the three that we identified as factors. So I'm just going to, in the interest of time, these are all the other factors. I'm going to skip through these, but they're all there in the Mental Health Commission of Canada. If you go on their website, or if you go on Guarding Minds at Work, you can see all these factors of growth and development. Recognition and reward was another one that people have mentioned. What are we doing to acknowledge, appreciate our employees' contributions? Some other ones is involvement and influence, where the employees are part of the process and how the work is done and making decisions on how the work is done. Also, some other one is workload management. So, having to look at the workloads of employees. That is a big stressor. Engagement. So, do employees feel engaged, connected to their work? Are they being challenged or being part of the work, or need to feel that they're making a contribution to the work? Another one is balance. So what are we doing to promote life-work balance in our workplace and that, right? So another one that I always promote it as life-work balance, not work-life balance. So we want to make sure we put our life first, because we can't do work, we can't do anything else unless we're not looking after our life first as well, right? So does your workplace promote that? And during COVID, and now where the work roles are now blurred a bit, where people may be working from home and stuff. Again, we want to pay attention to that, right? And so balance side there's psychological protection. What are we doing to protect our psychological health and safety in the workplace? Physical safety. So what are we doing to protect our physical safety? Because with that, if we're not protecting our physical safety, we can impact our psychological safety. So some of the things with these are the 13 factors. So from what you know now, what is one area, there's room for most improvement in your workplace? So let's try this poll thing again now. What is one area, from what you know now about the factors and that, what is one that you think would be most important to look at in your workplace? So I'm just going to show you the results and just see. So psychological support seems to be, again, the most popular, where that people see most improvement. Organization culture, clear leadership and expectations. So what I'm seeing is it looks like psychological support and clear leadership are actually pretty close. Psychological support, about 18% so far. Oh yes, workload management. Okay, if I look down through my screen here, yeah, workload management is also very high, 25%. And balance, okay, workload management, okay, it looks like it's the highest. Okay, so it looks like, yeah, I'm looking at my full screen here now. It looks like workload management is one that's most concerned for improvement in your workplace. Okay, folks. Well, thank you for that. So we're going to keep that in mind when we get to our next later on here, and what can we do for our own psychological health and safety in the workplace. So I'm going to move along then. So we're going to keep workload management there and balance. So the cost of doing nothing. Okay, if you don't do nothing, right? There's a cost, obviously, as we know. Um, Disability claims, absenteeism, again, presenteeism, going to be increase in illnesses, injuries, and that grievances and complaints will be a lot higher. You're going to see more staff turnover. People are going to be going to work looking at the job postings. Where can he go to get out of here? You know, legal implications. You know, are there going to be some human rights claims put in or and that, right? So again, that's the cost of doing nothing in the workplace if you have some of these things occurring. Um, and some of the benefits, why we need to look at this, we want to make sure we increase employee creativity initiative. So, people will feel more connected to their work and will be more likely to want to do well in the workplace. So you also get better employee retention rates, lower absenteeism, lower presenteeism. You're probably going to get higher quality of work and higher levels of collaboration with your team members and that, right? Healthier levels of employee stress and improved resiliency. So, people will be able to manage their stress. They won't be overwhelmed by it or won't be constant cumulative stress. People will be able to feel a bit more resilient to be able to handle situations when they come up. It's not a constant thing. Again, you're going to see reduced grievances, employee satisfaction, engagement. So people will be more engaged with the workplace, more likely to want to do more for the organization. And then there's also the prevention of human rights complaints and improve recruitment of talent. So people will know that this is a great place to work. I've talked to several employees. They love it there. They find it, really satisfying. That so you probably get more, better employees who want to stay there and work there in that organization. What's in it for employees and unions? So if you're a member of a union or you're a manager, supervisor, again, you're going to have a more productive workforce, reduce absenteeism, sick leave, which goes a long way helping the other staff members who may have to fill in for people who are off, right? Help your employees and members stay healthy. Worker compensation premiums do not increase. Your great and skilled employees will want to stay there. People will keep their jobs, and there's a good reputation and commitment to corporate social responsibility. So you'll see a lot of some workplaces that will promote that they're a great place to work. They're very responsible, socially responsible workplaces. And that so you look at places like Bell Canada, for instance, right? A lot of people see them as a really great supporter of workplace mental health and that. So where can you start? So for you folks, now that we identified some of the things that we want to work on, workload management and balance were high. So what is one action item that you could do today that could be effective in your workplace? So based on some of the information, we covered a lot, and we covered it kind of. We didn't get into too great detail, but from what we've touched on in terms of the psychosocial factors and all that, we've identified several areas that we think that our workplace we could do better at. What's one action item that you could do today that you think could be effective in your workplace? And you can add your questions to the chat. What's a takeaway that we could implement today, tomorrow, in our own workplace, or even in our own personal lives? What's something that we can actually add now, even on a micro level in our workplaces? So someone said not feel guilty for setting boundaries and taking breaks. Absolutely. Make sure I take my breaks each day, even if I have too much. Absolutely. Take your breaks. Um, Set boundaries. Advocate for clear expectations from those. So, yes, talk to your manager. Sometimes we need to manage up to our managers, manage up and let them know what we can't do, or what we need in terms of, information and understanding. Um, some other continue to encourage discussion amongst staff. Yep. Make mental health and mental wellness a normal conversation in your workplace. Um, some other ones, great responses here. Make sure that we meet the mental health needs of staff, right? Listen empathetically to those who are stressed. Sometimes we can be our own worst enemies. We're not as empathetic sometimes. So being empathetic to those in our own profession or work roles in that. Don't take on something where you're not an expert at. Make time for your self-reflection. Absolutely. Take time away from phone calls and emails. Yes. Just because your phone rings doesn't mean you have to answer it all the time. There is, several hours in the day you can get back to someone. So these are some great suggestions, folks. Thank you for that and what we can do. Self-care is key, and self-care is such a, I think, is a great thing, because unfortunately we don't have control sometimes over the way things work in our workplace, or the system of our workplace and stuff. So we only thing that we might have control over sometimes is our own self-care. So doing things for our own self-care, and I always tell people to practice self-care, make it a part of your everyday thing. Let people know, that I'm not taking calls now. I'm on lunch break, unless you're on a emergency call line or something like that. But obviously, take calls or stuff like that, or limit the number of meetings you go to, or make when you're off work. Don't use your phone. Let people know I'll get back to you the next day. Or if I send you an email, that doesn't mean you have to respond. I'm just sending it to you now. But I don't expect you to respond till the next time you're at work. So setting those boundaries and stuff. So thank you, folks, for that. So we'll move along then. So those are some things we want to take away. Some other things, if you're involved with, occupational health and safety or wellness in your workplace. These are some strategies, some resources you can use. So accessing, assembling the pieces, implementation guide is a great resource that you can use. If you want to become a champion in the workplace, to promote it in your workplace, it's something you can do. Get involved with your occupational health and safety, or if there's a mental health wellness group in that. So these are some things that you can do to actually improve your own workplace on a systemic level. And remember that big changes happen one small step at a time. So when you think about, say, I don't know, smoking guidelines now that we have in workplaces. Back when I was working, I remember, working in the Waterford Hospital years ago, you know, everyone was smoking in the hospital. We had like the cafeteria had a smoking section. We would roll cigarettes for people, right? So again, you would never see that now, but now we realize that it is the right thing to do. And so this will happen gradually, looking after our psychological health and safety. So again, we all have to take what small step can we take to make that change in our workplace and that. So these are some resources. If you want more information, like I mentioned, some of these, the videos and some of the psychosocial factors, you can find those on Guardian Minds at Work website. Also, mental health first aid is a course that we teach. We also do mental health first aid for adults, seniors, and youth. So there's a lot of courses that CMHA offers from time to time. So there's lots of resources that you can access through the Mental Health Commission Canada. Like I mentioned, Guardian Minds at Work, workplace strategies for mental health. Some great resources there as well that you can access. Very useful. And some of the trainings that CMHA offers. So again, Changing Minds is a great resource. They offer that sometimes through our website. There's also a bounce back program that's a free program on our website that you can access for training and self-help in terms of stress, anxiety, or low mood. You can access to a course and a online help person as well, coach. Coworkers First is another course that we offer for workplaces, for managers, supervisors, and how to help employees who with mental health concerns. Mental Health Works, Safe Talk and Assist are programs around suicide prevention and awareness in workplaces. So there's a number of courses that if you check out the CMHA website under our resources and events section, and under the workplace mental health program, there's lots of resources. From time to time, we offer free courses. And I should take the opportunity to tell you about a program that we just started called the Wellbeing Learning Hub. And so they offer free courses, free webinars on a monthly basis right now. Hopefully, we're going to start doing every 2 weeks. But we have one coming up now on understanding anxiety. So that's coming up on November 16th, and it's a free course. So we offer these free. So if you're looking for some professional development courses in that, so lots of great courses there in terms of self-care. So we have one coming up on November 16th. So I would suggest check our website for that, and the other ones coming up as well. So lots of great resources out there to take advantage of. And that is it. Sorry, folks, for the disconnection here with our line there, but hopefully you can access a lot of the information, like I mentioned, through the Mental Health Commission Canada website, and also you can also get it from the Guardian Minds at Work website as well. Any questions?
Thank you so much, John, for this excellent presentation. And we were so happy that we were able to get you back. These technology glitches happen from time to time, so you certainly rolled with it and did a great job. So thank you for that. So if anyone does have any questions, they can type them in the question mark widget, and we'll certainly get those. John, just to start the question and answer period, would you have a question around? Do you have any tips on how to get this conversation started within organizations? So in terms of talking to our workplaces and colleagues about the importance of psychological health and safety.
Yes, well, a great way we find is having getting a webinar or a presentation or someone to come out, for a lunch and learn. We find sometimes when we come out to places that after when I talk to this person who maybe organized it, there's a lot of conversation that gets generated afterwards. And sometimes people aren't aware of the resources out there or the reasons why we need to be talking about this. So sometimes just having a someone come in and have do a presentation. Sometimes we do stuff for like mental health week or wellness talk day, or maybe it could be occupational health and safety week, or for whatever the reason. So sometimes going out and having booking a presentation or webinar sometimes gets the conversation going, and people may get together afterwards and say, "We need to, implement this, or we need to put this in our workplace, or we need to start looking at this." That's one thing I know, and even putting up information on a regular basis, sharing it on, I don't know, through email or listserv within your organization, resources and stuff. Sometimes gets people talking more about it and makes the conversation. How should I say? It normalizes the conversation for people, right?
Okay, thank you. Another question is around training for leaders. Is there any training or what kind of training is available for leaders in workplaces for responding to mental health concerns of employees?
Yeah. So there's one by Coworkers First, and that comes from our CMHA office in New Brunswick. So we offer that as a great one-day course for leaders and how to, be aware of how to start that conversation with someone who may be, experiencing or struggling with mental health in the workplace. How to identify, is this a mental health concern as opposed to a work, issue, and how to respond and how to offer and collaborate with that person to get help. A lot of times people find it uncomfortable having that conversation, that initial conversation. So this teaches a lot of different skills in how to do that. We also do Mental Health Works as well, which is another national program that we offer as well for managers, leaders, union leaders, and supervisors for workplaces, and how to have those conversations in the workplace, and how to, be aware of things that can impact people's mental health in the workplace, or things that can, cause further issues for someone who already has a mental health concern, right? So we have those. We do also mental health first aid is a great course for anyone to take when they want to learn how to better respond to someone, with declining mental health or a mental health crisis. So some great courses there. So I would definitely recommend people to go on the CMHA website and check out the training menu under the workplace mental health program. So there's a lot of different courses and that even webinars that we can go out to do for workplaces just for a 1 hour introduction on different topics, right?
Oh, thank you. And someone's asking about the, I guess, the branches in other areas of the province. How would they
Yes.
connect with people from,
Yep.
workers from those branches?
Yeah, so I realize there's people on from different parts of the province here, and great to have you on with us. So we're province wide. So we have a branch in Grand Falls, Windsor, and we also have a branch in Stephenville. So they service those areas. One service the western part of Newfoundland, the other service the central, and actually our western office will also service Labrador. So if you just check with the CMHA website, I think it's up on our screen there now, cmhanl.ca, you can find the different branches there. And so we have a coordinator in each office. So you can reach out to them and they can certainly do something for your workplace or in your area for sure.
Mhm. Okay, thank you, John. In terms of, I think we have a couple minutes left, but maybe if you have an example of how a workplace, started to achieve this and started to focus on psychological health and safety, what made a difference for them and what that process kind of looked like. Do you have any examples around that?
Well, I think Eastern Health has already implemented the standards and using them. So you might see some things that they might do. They might start to promote mental wellness. They might actually form a committee, mental wellness committee, and that, or have a part of their occupational health and safety committee. And so they might start to implement some programs that can, promote mental health in the workplace. So you might see they might have a peer support program in the workplace. I think that's something that Eastern Health has started or are in the process of starting. They might actually implement some programs. So we know some workplaces that have Not Myself Today program, which is a national program of CMHA, and it's basically it builds awareness in the workplace of mental illness, breaks down stigma, and promotes mental wellness in the workplace. So different activities that you can do to promote it, be aware of it, and talk about it. So you might see things like that in workplaces as well. So they might start, and they might also start to, you might see, promoting their EFAP programs or the benefits of their under the EFAP program and that, or advertising that to staff that it's something there for them to use. You might see, people endorsing it and, how sending around more information to people on how to access it and that, right? So, and you might see workplaces now will start to have, celebrate, Bella's Talk Day or Wellness Weeks and that as well, or have wellness activities in the workplace or as part of their work and that as well, right? So, all these things you might start to see now in workplaces.
Wonderful. Thank you so much. So that concludes our Q&A. I want to take some time to thank John for this excellent and informative presentation and for you sharing your knowledge, experience, and expertise with us here today, this afternoon. Having an opportunity to focus on learning and having some discussion on psychological health and safety in the workplace is important, and regardless of one's area of practice. And we really hope that this session provided you as RSWs with information that you can integrate into your own workplaces. So RSWs may claim 1.5 CPE credits for attending this webinar as per the NLCSW CPE policy. And we also have an evaluation form that will appear on your screen, and we do ask for your feedback on that as well. And John, I don't know if you had any final words that you wanted to note as well before we sign off.
Yeah, I just want to say apologies for the freezing up there, but as some self-care homework for everyone. It's nice and warm out now. I looking out my window, so maybe you can get outside after work and get out of the freeze up that my computer has been causing. So that's the only bit of advice I can give you.
And thanks again, John, for rolling with that technology, those technology glitches. It was great that you were able to get back on so quickly. So that was wonderful. And despite the challenges, you did a great job. So thank you once again.
Thank you, folks, for bearing with me.
Thanks, everyone, and enjoy the rest of your day.